PPMD project, one of our deliverables is to articulate the Northern Ontario perspective on postpartum mental illness. It's important for us to consider the unique characteristics of Northern Ontario and how these may impact service delivery and treatment delivery for postpartum mental illness in Northern Ontario. This is a significant geographic area. The unique characteristics fall into two different categories, which include the geographic and the demographic characteristics of Northern Ontario.
I think the project is very important about getting the conversation about PPMD started, and that there's a need to look at different cohorts, that we can't study conditions like postpartum depression in large urban centers and know that the results are reliable to smaller urban areas. Some of the evidence-based therapies or treatments, if we're talking non-pharmaceutical, so not medication, and we're talking things like cognitive behavioral therapy and interpersonal therapy, that accessibility to those types of highly specialized treatment are going to be very variable depending on where you live.
Most of the services that women would see would be more general here. What we don't have in a smaller community is those more specialized services. So a postpartum mood disorder group, being able to have the numbers to be able to run something like that might be difficult. Having, someone who's more specialized in those kinds of services, we don't have available in smaller communities. So quite possibly more training, more community education can offer people like me the opportunity to be more informed in what I do as far as postpartum mood disorder goes. Some of the things that are unique to Northern Ontario certainly is the distance that women have to travel to give birth, the time and attention that has to go to being in a different community and trying to manage the end parts of your pregnancy at a time that can be very stressful. It can be very difficult for families at a time where you want it to be a very joyful, stress-free time.
I think it starts right from the beginning when you are pregnant, or even before when you're considering pregnancy, getting access to those services. It can be a bit of a challenge. When I was pregnant, we decided that we wanted to be in a bigger center where we had all the medical support that we would possibly need. But that meant going and having appointments with an obstetrician ahead of time. Thankfully, he said that we only had to do one visit with him and then come back when we were due, which was a huge relief to us. Any healthcare issues that require more intensive kind of care, then you really run into having to leave the community to access that support. When I had my first child, I was actually very ill, and I had to be hospitalized for 2 weeks, like almost immediately after I had my child. And so that was that added stressor of being on the road and out of town, and just expenses, and it just kind of snowballs, and that was hard.
I think probably one of the biggest differences for women having to birth in Northern Ontario is having to be away from their homes. Many women. In fact, I think the numbers are about 80% of women who live in Northern Ontario have to deliver far from their home. And so in our setting, that means women are delivering their babies over 200 kilometers away from their home. And with that comes different stressors than perhaps people who live in Southern Ontario or women who live in Southern Ontario. So the biggest one being the financial burden of that, but I think the more important one is the social stress that causes at a time where we're trying to keep anxiety low.
From day one, when they find out they're pregnant and they talk about services here, I have to let them know that they'll probably be delivering in a larger center. They might end up spending 3 and 4 weeks waiting to have their baby. By the time it comes time for the delivery, the whole family stress level can be pretty high. And the higher the stress level, the more at risk they are for postpartum. So it is a challenge. There's no place to hide in a small community. If you've got any kind of postpartum mood disorder, People want to be reassured about confidentiality, mainly because they're concerned about the possible stigma of people knowing that they're not the perfect mom that they really hope to be, that they're having these thoughts or feelings that are making it less enjoyable for them to be a parent.
Stigma is something that we're constantly trying to battle in terms of any type of mental health condition. Specific to the North, and particularly in very small communities, I think the stigma issue is even that much greater. Everybody knows each other, so they may be concerned about disclosing symptoms because they don't want other people to find out. So I think that we need to continue that conversation about stigma so that mothers feel comfortable coming forward, sharing their stories, because we know, again, that there are effective treatments for postpartum mood disorders, and that if women come forward, if we can have them diagnosed, they can get better and they can recover. And so, of course, we want that to happen in a timely fashion so that women aren't suffering for lengthy periods of time.
We do know that social support is a moderate risk for postpartum depression. So if you are lacking social support, you are at greater risk. Marital status as well as maternal age are also risk factors for postpartum depression. When we look at single mothers and adolescent mothers, if you don't have the social support, you are at greater risk.
Because I was a teen mom, there was a lot of doubt thrust upon me. Like all of a sudden it was like, okay, well, you need help with this, you need help with this. And the list just kept growing and growing and growing. So almost to the point where I got overwhelmed. There's a stigma about when you're 18, you have a newborn, you're suffering from a mood disorder, you have that put upon you, and then they're in your house all the time. It's very scary. People were expecting so much out of me, but yet I couldn't reach those expectations. So the fact that one day I was just sitting on the couch and I didn't leave my house for months. Like my husband would leave and he would get groceries and then he'd come back and he'd cook supper, then he'd clean the house and then he'd take care of my daughter. Like it was to a rough point of like my life pretty much. Like didn't want to move, didn't want to do anything, didn't want to talk to anyone. Like it was a struggle.
The other issue that I think is important for the North that has been understudied is postpartum mood disorders among Aboriginal women. There's not a lot of literature about postpartum depression among Aboriginal women, and if the prevalence rates are the same and what effective treatments or resources might be available.
Communities have a sense of celebration, and if a woman is not celebrating being a mom or stepping into the role easily of being a mother, then sometimes communities become concerned about what's wrong with this person and what do we need to do to help them. In many of our communities, we don't have access to the practitioners that make the diagnosis. So many of us don't have medical doctors or nurse practitioners or psychologists or psychiatrists that work in community. So we need to be linking with those healthcare providers outside of our community to make the diagnosis. And that can be a challenge if first off, if that person doesn't even have a healthcare provider. And that's a reality for lots of Indigenous people.
I support the work of the Northern Ontario Postpartum Mood Disorder Project and really investigating what's going on in the North. The emotional mental health of new moms, new families is really important, and I'm happy that this study is funded, recognizing that it is a gap that needs to be addressed.